Shannon.
Welcome, everyone. We are really happy to have so many people joining us this morning. I am Judy Lewis. I am the board chair of Women in Health Together for the Future. We are very pleased to be doing this very important webinar this morning. And before we begin, I just want to tell you briefly about our organization if you're joining us for the first time. So we are a group of health professionals, community members, and advocates from 24 countries around the world. We incorporated in South Africa in 2019, but have a history prior to that going back to 1991. We welcome you to join us. It is possible to become a member, an associate member, without paying a dues, or you can pay a modest amount of money to become a full member and have full access to all of our resources. Go to w24f.org and you can get all the membership information there. So thank you very much for joining us this morning, this evening, this afternoon, wherever you are. And I'm briefly going to introduce Dr. Yadar Banga, who is a founding member of the organization in 2019. Dr. Bangal is an OBGYN who has worked on maternal health and public health issues for his entire career. He has been at the University of Pavara, the Medical Institute of Pavara, in Loni, Amritsar, Maharashtra, India, for 34 years. He has been passionate about all of his work and very much involved promoting women in health activities at the community level in all of the areas surrounding the Medical Institute. He is an amazing person in terms of all of his publications as well as his community mobilization efforts. And I can't think of a better person to introduce this webinar with Professor Somasundaram. And we're really looking forward to hearing your presentations.
Thank you, Judy, for your kind words. And as a moderator for this particular session, I welcome all the participants for this very important activity, the topic that we really do not often discuss. And we do not really think that this particular topic or the community, which is tribal, uh, needs to be discussed. But we all understand that they form significant portion of our population and their health needs must be addressed. Today, for this important topic, we have Professor Som Sundaram, who is working at Pravara Institute of Medical Sciences since last 35 years. Uh, I'm happy to introduce Professor Som Sundaram. He is presently Director and Associate Professor of School of Public Health and Social Medicine and Dean, Faculty of Allied Health Sciences, Pravara Institute of Medical Sciences, Loni. He has master's degree in biostatistics and public health. He has also specialized in rural energy and development. Uh, I'm happy to say that he is an adjunct faculty for the College of Pharmaceutical and Health Sciences, Drake University, USA, and the College of Nursing and Public Health, University of New Jersey, USA. He presently heads Pravara Institute of Medical Sciences Center for Excellence in Tribal Healthcare and Research of Ministry of Tribal Affairs, Government of India. He has published more than 40 research publications and is recipient of many awards and recognitions. He is an active member of many professional organizations, and we are very happy to hear him about his work. Last 20 years or so, he is working in tribal area. He is coordinating all the activities of this university in tribal region, and he has vast experience about this tribal health. And we are very happy on behalf of WHTF. I welcome Professor Som Sundaram for this particular session. To begin this session, I would like to say something about tribal health, the community, and their health issues. Before we hear to Professor Som Sundaram about what Pravara Medical Trust is doing for this particular community since last 20 years. So I would like to share my screen to give you brief about the tribal health, how these people live, what are their issues, how their socio-economic determinants are affecting their health, physical as well as mental health. So to begin with, is my screen visible?
Yes,
Hello,
yes,
is my screen visible?
yes.
Judy?
Not yet.
Not yet.
I can see it.
I can see it too. I can see it too, Vidya.
It's visible. It
It's
is
visible?
visible. Yeah.
Yeah. Okay, so good evening all. Tribal community, this is the tribal people, which may call them as primitive, tribal, indigenous, aboriginal, or native. They form significant portion of our community. Almost in India, 8 to 9% of these tribals form the total population. If we think of global uh, situation, 6% of these tribals form the global community. Let us talk about the tribal health in India and what are the socio-economic and cultural determinants of this. This population is usually been ignored by the government, by the policymakers, and they are not really being given representation into the general society. The tribal culture blooms actually in the isolated highlands and forests of India. Number wise, 8.6% of India's population are heavily marginalized and discriminated against. Not only are tribal communities socioeconomically othered by the mainstream Indian populace, but they also face a host of structural inequalities, with access to healthcare being one of the biggest. If we think of Indian situation, this population, which is designated in red, they are situated in particular part of the country, regions of the country. Mainly in the eastern region, they are highly populated, whereas in southern part, there are no much of this tribal population. While there is consensus that amongst policymakers that tribal communities have poor health and restricted access to healthcare, there are still no comprehensive policies that meet this need, and no reliable data about the state of tribal health is available. Tribal healthcare in India usually falls within the ambit of rural healthcare. People think that rural people and the tribal community are the same, which is not so. Tribal community has different epidemiological structures, their terrain, their environment, social systems, and cultures are totally different, and they actually are being ignored or marginalized. In India, there is a separate Ministry of Tribal Affairs, and there are laws related to tribals and forests. Health and its correlates. The UNDP Human Development Index comprises three components: health, education, and income generating capacity. Literacy among the tribals is very low, it's almost 26%. But if we consider women, it's less than 14%. So, literacy or the illiteracy is a big problem for this community. Sex ratio is quite good. Sex ratio as compared to the non-tribal community is very good, and that is something which is good. Factors affecting the health of tribal community: there is widespread poverty, illiteracy, malnutrition, absence of safe drinking water and sanitary living conditions, poor maternal and child health services, and a lot of other problems this particular community face. Tribal community, let us see the social, economic, and geographical cultural determinants and challenges. This, as I said, it's deprived of basic nutrition, sanitation, and health. Poverty has plagued the lives of tribal folk. The unequal distribution of assets such as land, along with failure in crops due to erratic rainfall and floods, are caused poverty in the countryside. Lack of skills and education is another problem in them. They are deprived of basic human necessity of nutrition, sanitation, and health. So let me show you some pictures which are self-explanatory about the living conditions of these tribals. They live with a difficult terrain. These are the living conditions. They are poor road conditions. These are how this is the hilly area, and poor road connectivity, poor housing conditions in which they live, poor housing and sanitation facility. They face adversities from womb to tomb. So if we see them at all the age groups, this tribal community is adversely affected. If I really put them into tabular form, all the age groups from the intrauterine life till the elderly people, all these problems are being faced by this tribal community, and the policymakers are really not aware about what this community is facing. From very childhood, these students lack, these children lack education facilities. Even if they are there, they are very primitive. Child labor is quite common. From very childhood, they are being asked to work in the field. Cultural norms and traditions are there. Teenage pregnancies are quite common. Early marriages are common, and that's how these women have these small kids when they themselves are kids. Active involvement in the agriculture work is being seen in this. Water scarcity is a regular problem. There are laborious work for earning daily wages. Life is a challenge, carrying loads of wood. Life of a tribal woman, caring for livestock. They are all usually um, they are all engaged in looking after these livestock. Agriculture workforce, mainly women and even the young girls. There's a lot of blind faith and belief in this community. These are some of the pictures depicting the same. Tribal women, her earning matters for the family, and these are some of the jobs these women are doing: selling eggs, maybe selling fruits, fish, and maybe these other uh, cow dung slabs, which they use for their energy source in the houses. Fishing to earn livelihood, means of livelihood. These are some of the other pictures. In this previous picture, these are the in last picture. They are selling the homemade alcohol. These are the children. For them also, the life is quite difficult. They're a large size family. Undernutrition is prevalent. They are still using conventional energy sources, which have direct influence on their health. The way the tribes cook, these are the conventional sources of their cooking, the methods of cooking, the foods they eat, and of course substance abuse is quite common, tobacco and alcohol being the important substance abuses seen. There is a lot of blind faith in this community, and they do sacrifice goats, and there are certain fortune telling parrots, and that's how this community gets involved into all these practices. Faith on godmen. What are the reasons for their problem, health problems? These are the reasons: carrying loads of grass on head, long distance walking, carrying loads of cow dung. Now, healthcare and the health facilities are very meager. Healthcare and its providers are seen here. They are all not very well trained, practitioners. Hospitals in tribal area also are very few, and they do not have any modern facilities. Health seeking behavior of this tribal community is really questionable, and treatment of fractures and snake bite is still being done by traditional methods. Tribal community and herbal medicines have very close proximity. Traditional healers are there. Health facilities, availability and accessibility is again a big issue. Lack of care during pregnancy, childbearing and maternal mortality is quite high. Abortion practices among tribals, still they are being used. All those traditional methods are which ultimately result into some sepsis. Traditional birth attendants, they do provide delivery services. Even today, previously they used to be traditional birth attendants. Now the government has trained them, and now it is been trained birth attendants. Due to lack of transport facilities, emergencies are very difficult situations to manage, and thus pregnancy complications and delivery complications do happen. Obstetrical emergencies do happen. In addition to all these health problems, there is risk of wild animals attacks and its consequences. These are the wild animals which attack those inhabitants of tribal area. Grave life-threatening injuries happen. Children are most vulnerable by attacks of wild animals, honeybee stings, poisonous stings, minor injuries, and this is how the life of the tribal is really very, very difficult. Now, considering all those social, economic, cultural background, Pravara Medical Trust is doing a lot of work in tribal community. With this, I stop here and request Professor Som Sundaram to continue with his talk. I already introduced him, and we all are eager to hear him about his experiences at Pravara Medical Trust about the tribal community. Thank you very much. I request Professor Somsundaram to proceed with his talk.
Thank you very much, the organizers of today's webinar, all the organizing committee members and the members of Women and Health Together for Future, especially Dr. Judy Lewis and Dr. Surekha Taide and Dr. Pangal, my colleague. Can you see my PPT?
No.
Not yet, sir. Yes.
Is it visible?
Yes, but needs to do full.
Yeah. I once again thank you and welcome all the participants of today's webinar. I am here to share the journey of Pravara Medical Trust and Pravara Institute of Medical Sciences for the last 20 years in the field of tribal health, development, and empowerment of the tribal people. I am here to represent the Pravara Medical Trust and Pravara Institute of Medical Sciences, both the organizations who have been contributing from the management and the faculty, students, and staff. On behalf of them, I will be sharing my experiences and the experiences of all our faculty and staff. The Pravara Medical Trust, which was formed in 1972 as a non-governmental organization by the local community leaders, local farmers, who thought that they have to help themselves in the developmental process of their area and their own lives. So they started a integrated rural development model in this remote rural area, which is about 300 kilometers away from Mumbai, which is the state capital. And from 1972, and actually the whole model was started in 1950 with the initiation of a Pravara cooperative sugar processing unit. So in order to develop the whole rural areas, they thought that all sectors have to be taken care. So in 1972, they started to work in the field of healthcare, and initially they started working with a 200 bedded hospital in Loni, which is a very remote rural area, from primary to secondary care to provide, and with a mission to serve the rural poor, with a vision to improve the quality of life of the rural poor. And the approach is integrated so that all sectors will help in improving the quality of life and health determinants of the local people with a holistic and problem solving and community oriented approach. All the institutions today who work under the ambit of Pravara Institute of Medical Sciences, which was recognized as a deemed university by the Government of India in 2003. But prior to that, the Pravara Medical Trust has started a number of academic institutes. The only medical college in a rural area in India in 1984. This is the only rural medical college in the sense it is in a village. There are many other medical colleges which have come up, but in the tier 3 and tier 2 cities, but not in a rural area. So it was initially started in 1984 in a village. Then the other educational institutions have been started under the same Pravara Institute of Medical Sciences ambit, College of Nursing, Dental, Physiotherapy, Public Health and Social Medicine, Biosciences and Technology, Ayurveda, which is the Indian System of Medicine, and College of Pharmacy. Now today the university consists of 8 constituent units, and all these constituent units have an institutional social responsibility. As part of the institutional social responsibility, all the faculty and the students and the staff, with the encouragement of the management, involve in the community developmental activities to lead a more just, equitable and human sustainable society. So it has developed the integrated comprehensive rural and tribal healthcare model with a 1,375 bedded tertiary level hospital and a dental hospital and a very well equipped physiotherapy and rehabilitation center and a cancer center and extension activities for in the area through primary health and other activities, including mobile clinics and motorbike ambulances and a Ayurveda hospital. Since beginning of the rural medical college, the Pravara Medical Trust thought that we should adopt a pedagogy which is community oriented health sciences and medical education. So the education, pedagogy and the research that we do should lead to community empowerment and rural development. So now I am coming to the area where we are working in Maharashtra. Dr. Bangal had already given the socio-economic and demographic characteristics of all over India, the tribal population, how they live, where they live, and all those things. But now I am just giving a glimpse of Maharashtra, which has almost a little over 10% of the population is tribal. And this is the second largest tribal populated state in the country, and which has almost 47 different tribal groups live in this state, and of 47, 3 are primitive tribes. They are called particularly vulnerable tribal groups. And most of these tribal communities live in the Western Ghats, which are the range of mountainous range, Western Ghats of Maharashtra. And almost all the districts of Maharashtra has tribal population. But there are some districts where more than 20% of the population is tribal. In some district, 10 to 25%. So most of them live in the interior areas of the mountainous areas of the state. Now coming to our intervention, Pravara Medical Trust intervention in the tribal areas. Although it dates back maybe something 1998, when we started our work in collaboration with the Ministry of Health and Family Welfare of Government of India to train the traditional birth attendants in the tribal areas. But later on, we started working as a multi-sectoral approach, developmental approach in the tribal areas with the support of the SIDA, that is the Swedish International Development Agency. Initially, they funded for 4 years, but later on, the university and the trust, Pravara Medical Trust, is contributing and further strengthening the model that we have started in 2006.
Sir,
And
excuse me. We have little limited time for the webinar. We
yeah,
need to have time for the
yes,
discussion.
yeah,
So
yeah.
we
This
will be
is this
briefly.
whatever we started has been recognized by the government of India as a center of excellence. And this is the area where we started working about 100 kilometers away from the university, and about 100 villages we have selected for development and providing healthcare services. These are the some glimpses of the area, and the focus was on maternal and child health. And this is the campus that we have developed in the tribal area. And I'm just showing here a 2-minute documentary of the work that we are doing in this tribal area. So we have a general physician who looks after all the outpatient, and we have a ICU, we have a NICU, we have a dental treatment unit, we have X-ray facility, and we have a daycare center, we have a ambulance facility, and we have a mobile medical unit. There is a tribal museum which reflects the cultural rich culture of the tribal people. And there is a research center where our students and faculty will visit. And this is a guest house, a small guest house where our faculty can reside. This is the mobile clinic, and focus is on maternal and child health. There are 2 centers. This is the second tribal health center in the same area. This is the topography. And we focus on mainly the primary to tertiary care with grassroots level to tertiary level, with a focus on gender equality and women empowerment and SPCC. Our specific objective is improve the women's status. And there is a model that we have developed. It is a 5-layer model from grassroots level to the tertiary level in these 100 villages, covering about 1.5 lakh tribal people. And at the tertiary level, the university hospital provides the tertiary care to all the referral cases of the patients coming from the tribal area. And even the medical university hospitals and the students regularly visit the tribal area and conduct multi-diagnostic camps and specialty camps, and whoever referred to the hospital, they get a free treatment. And the 2 tribal health centers that we have, they are 24/7 centers, provides general care, women and children care, and normal deliveries are conducted there. And we also have a neonatal ICU, X-ray facilities, lab and dental facilities, and Ayurvedic clinics. And we also provide reproductive and child health and cancer awareness camps at the tribal health center also, and in the community regularly by the health centers, tribal health center, as well as the university hospital and the medical colleges. We have the mobile medical clinics, which are every day, of course, 2 villages they cover. and we have these clinics regularly conducting OPD and maternal and child health services at the doorsteps of the tribal people. Because we have a mobile clinic which is difficult to reach certain areas which are very remote, we have designed a motorbike ambulance and a motorbike health clinic with the support of a corporate social responsibility. So we provide all the emergency care for about 500 lives are saved every year. And this is the regular means of transportation in the tribal area with a state transport bus and the private jeeps, which are very difficult for transportation. So the motorbike ambulance helps them in transporting the cases in right time to the health centers and the higher level centers. And the same motorbike ambulance is also used as a motorbike health clinic with two nurses, one male nurse and one female nurse will go and provide the preventive care to all the, especially the maternal and child health care. These are some of the preventive care at the doorsteps that they are providing. And even at the workplaces, the motorbike ambulance can go because most of the tribal women work in the fields during their pregnancy. And we also have a novel concept of at the village level, we developed a village health and wellness centers involving the local women, and we have trained them and provided digital kits to them. So they are using those digital kits and a first aid box and a lab facility and a health library is given. So they provide primary health care at the village level. We also have a WHO concept of health promoting school. So we have adopted 12 tribal schools to provide WHO concept of health promotion. So it is called School Health, Hygiene and Environment Program. And especially in the tribal schools, provide sanitary napkins, school uniform and other things. And we conduct health promoting school workshops to the school teachers, and all the constituent units of the university will visit these tribal schools and provide health education, health awareness and health checkup. And in about 125 female health volunteers who are trained work at the village level using the first aid and other primary care treatment. And we have developed a number of training modules, health educational material for them, so that they are culturally friendly. It is being used by the local schools and local community. And we have another concept of healthy village, again a WHO healthy setting concept. And using that healthy village concept, we are trying to promote all the health related development in the villages. And of course, for empowering the village women, we have promoted medicinal and nutritional gardens in the villages, and women self-help groups are being created to promote these nurseries. And also there is a forest product these women, village women collect and sell to the government for as a income generation. We also have some vermicompost units, production and distribution of this vermicompost by the self-help groups, women self-help groups. We also have a number of awareness activities for sexual and reproductive health rights, cancer and other advocacy programs for women in the area. We have a capacity building activity, especially for the tribal women and tribal youth. And the Center for Research and Tribal, because we have been working in the healthcare provision, but we thought we should focus on research and research-driven healthcare. So we established a Center for Research in 2018, and we are working with all the supportive from the central and state governments and international organizations. A number of research projects have been undertaken, and we have formed a team of researchers at the university. So who are specialized in various fields, they will be working in the area. And we have our own thrust areas, especially the documentation and testing of the traditional tribal medicinal knowledge, ethnomedicine knowledge that they have, and the practices that they are following, which are both healing and herbal medicine practices. And we have almost completed and ongoing 35 research studies which are being done by the students and the faculty of the university. And we have conducted for a networking of various tribal developmental institutes and who are working in the tribal health, a national conference through which we have collaborated with a number of organizations. And we have recently concluded a major research study of documentation of socio-economic and demographic profiling and documentation of the traditional healing practices. And we interviewed about 1,400 tribal healers and documented how they practice their herbal medicine and healing. And we have developed 25 case studies also in this. These are all the various tribal traditional healers, because now the government of India wanted to bring them into the mainstream of the primary health care. And we also run a certificate course in social health and development. A number of international students do participate in this certificate program. Every year we get about 50 to 60 students in 2 batches, January and July. And we have signed about MOU with about 35 universities all over the world. They visit this tribal area and participate in the various activities that we do. And this is a very briefly the impact that we have created in various maternal and child health indicators development. So it shows a reasonable achievement we could do with the help of the local tribal traditional healers and local women who are working for their own population, and with the help of the dedicated team that the university has. So we do have some operational challenges, and because most of the organizations do face these challenges, because for recruiting and motivating and retaining the qualified staff, because they are not ready to work in the remote tribal areas. So we face this challenge, and the distance, because 100 kilometers we are about, the tribal area where we are working is 100 kilometers away from this. So time management and the difficult terrain that where we are working, weather conditions may not cooperate a number of times that we want to work in those areas. And also the information technology is booming in India, but we face certain networking problems in these remote tribal hilly areas. So we could not break through into mHealth and telemedicine services. We made a beginning. I think we made some progress also. We have a long way to go. Thank you very much.
Thank you, Professor Somsundaram, for your excellent talk on this tribal health and for sharing your experiences on this tribal health, which you are involved in last 2 decades or so. So there are few questions from the participants. I will request you to answer them. The question asked, one of the questions is whether there are traditional healers even today, and do they collaborate with the hospitals available in this area?
Yes. In the area where we are working, we have about 50 active traditional healers. We have trained all of them with a training module, and of course we have documented all their traditional healing practices. And now we are planning to validate their herbal medicine that they are doing. And also we want to give a further phase 2 training for them, including some specialized modules for them, because they are treating the patients in various methodologies. So we wanted to further train them, but they are there.
Okay.
But
Thank you very
because
much.
traditional tribal,
Sir, could you stop share the screen
1 minute, I'll just check
so we
whether
can
I
see you better?
Yeah.
And also, I think the voice is little low. If you can just move little bit towards the microphone. Just stop share.
Yeah.
Yeah.
Yeah, sir. Another question is,
Yes.
through our research programs, have we really assessed the mental health of this tribal community? Any
Yes.
attempt has been made?
Yeah. Yes. There because of the drug abuse, as you already seen, because the alcoholism is rampant in that area. So there are mental health related issues, and we have a program for community level mental health program. We have designed that program with the Department of Psychiatry of the university, and we will be soon launching that mental health, especially because we have to work at the community level and at the rehabilitation level both. So we are working on that because we have already trained the Arogya Mitras in identifying the mental health issues in their area.
Okay.
That is already done. So we have to work and how to intervene in that program.
Okay.
But there
Thank
are
you.
a lot of social issues in this. We have to address those social issues also because they don't want to accept that they have a mental problem.
Okay.
Initial non-acceptance from the community is
So
there.
that's why another
We are,
question
yeah.
is related to this. The one of the participant is asking, is there any community participation efforts being made that covers maybe funding for this activity or active participation in any of these activities, community participation?
Yeah, actually, there are non-governmental organizations working in the same area, and we work with those non-governmental organizations, and also in the community, there are community leaders, opinion leaders. So we in every village where we work, we form a village developmental committee and village health committee. Even where the schools where we are working, there will be there is a health committee, school health committee. So we involve the community members from the planning to the implementation of the programs that we are doing at the community level. Mainly here the community involvement is like there is a local leadership, opinion leaders, and also the Gram Panchayat. We call it as a Gram Panchayat, local self-governing body. So we involve the local self-governing body in planning and implementation of the activities at the community level. Because the Gram Arogya Bank, the concept is that it is only community ownership. The whole activity has to be taken because we only provide the technical support, but they have to own the complete primary healthcare model that is designed as a Gram Arogya Bank, that is a village level health and wellness center. So we train all of them. They also fund at a not only in terms of money, this is in terms of kind, because they provide the furniture that is required, equipments that are required, or the premises that is required, infrastructure that is required, that they provide those collaboration, but
Can
not
you
in
say
terms of money.
something about how the government is supporting this particular
Yes,
activity?
yes. Actually, we do get at a national level, of course, we are getting support for the research because we are now recognized as a center of excellence. So we get funding for the research activities, both at the national level and at the state level. There is a tribal welfare department and there is a tribal research and training institute at the state level. So we receive funding for research from the government of India. And at the local level, at the district level, there is a integrated tribal development project. It is called at the district level integrated tribal development project. So they also provide small grants for small activities, not a big grant. They help us in training and those active capacity building activities only.
So one of the participant is asking, since you said that we have prepared training modules for these
Yes.
traditional healers, can
Yeah.
these training modules be used for training in other areas of the
Yes.
state, like
Yeah, they
Gadchiroli?
can, but whatever we have developed is a local language. It is in Marathi, but we can translate that into English, and we that can be used.
The
But
person
only
who has
thing is
asked
because,
question, yeah,
yeah,
the question is from Maharashtra only. In
okay,
Gadchiroli district, they are
yeah,
asking.
yes. Then we can share. Then we can share to them because it is in Marathi. It has now 5 modules in the training. There are 5 modules, but we are planning to further phase 2 of the training module also we are planning to develop. But phase 1 we have already completed, which has a general basic sciences and Ayurveda, naturopathy, and other public health programs and all. So it is a basic training module is already developed.
Okay.
We have trained using that module about 300 at state level. We have trained about 300 traditional, tribal traditional healers
Any
on
other
as a
particular
pilot
activity?
basis.
Any other particular activity for well-being of the women or the girls or the school children in the tribal area?
Actually, the health promoting school, that what is a it's a very elaborate program because I don't have time to describe that, which is not just checking school health checkup. Because normally people think that school health program is only to health care of the children, but our health promoting school is physical health, mental health, and social health, and environmental health. All the 4 aspects are covered.
Okay.
So where all most of the things are done by the village, so school health committee only. We only train them.
Okay. Another question is, what do the training modules focus on? Whatever we have prepared for these tribal
Yeah,
healers.
that's I already answered. First is the one is a basic sciences, that is like physiology, anatomy, those things. First module will cover those basic sciences, and the second is the primary health care aspects, the first aid, primary health care, what is to be, what medicines that can be given for the primary health care. And third is Ayurveda, because scientific, because they use a lot of herbal medicines already. But so the scientific angle for the herbal medicines which they are using. So we provide in one modules the complete Ayurveda way of treatment, scientific treatment using the herbal medicines and other bark, oil, whatever they use. And the fourth one is naturopathy, because why these are just to introduce a scientific temperament in them, because they are close to Ayurveda, what they are doing as a herbal medicine expert, and they are also close to the naturopathy. So the naturopathy, Ayurveda, and primary healthcare and basic sciences, these are the 4 modules that we have developed so far.
Sir,
And we are
one
now
of the,
now tying up with the Ayush Ministry. There is a in the Ayush Ministry, and there is a QCI called Quality Council of India. So in collaboration with Ministry of Ayush and the Quality Council of India, so we are developing and certifying these after training, of course, after training with these modules, and there are special modules which we will be developing. Those modules, like if they are treating a jaundice, if they are treating a snake bite. So we have developed we are developing modules for the services which they are providing. So,
okay.
and it is a combined module that will be implemented in future.
Sir, our one of the very senior members of the organization, Dr. Amani Rafat from Egypt, she is
Yes.
expert in the field of gender-based violence and the issues related to that. She is asking that
Yeah.
are there any gender-based violence like issues, and is there any specific program aiming to fight this particular problem, gender-based violence?
Actually, gender equality is there. Culturally, tribal communities have the gender equality. And actually, in terms of women empowerment, it is easy to empower those women uh, in the tribal area. Although there are issues of domestic violence and all, like after maybe domestic violence, and that's why we are addressing them through sexual and reproductive health rights issues, and even the legal issues emanating from the gender violence and other things. So we have a team of people who help them in these gender related problems that are emanating from the violence, domestic violence.
Another member from South Africa, Professor Maja, she's asking that witchcraft is often a social and health problem in rural areas. How do you handle it
Yeah.
in the tribal area of yours? Witchcraft.
Yes. Now, witchcraft is there. That's why we have a special health awareness modules for the against blind faith and blind beliefs. So we conduct special awareness sessions on even the because although we help the traditional healers, but we always have a special module of training the general community and also the traditional healers also in the witchcraft and other healing practices on blind faiths and blind beliefs. So we because one of the major awareness session in the tribal areas is only working against the blind faith and blind beliefs and witchcrafts. They
Oh,
are very much prevalent in this community.
another question.
In this community,
Yeah.
actually, I'm tribal communities we are working. One is a already progressive tribal community, Koli Mahadev. They are a little progressive. They are almost into the mainstream of the culturally mainstream. But there is another tribal community in the same area, that is Thakur, where the blind faiths and beliefs and this type of witchcraft and everything is very much prominent in those tribal groups. So our focus is mainly on that Thakur community.
One more participant, Priyanka, is asking, while doing these training programs to traditional healers, do we face or whether we have faced challenges while training them or enrolling them into these programs?
Yes. A number of challenges. Actually, they don't spare any time to attend the our training program, and they are not interested to attend our training program. First is we have to motivate them to attend the training program, and second is the time is to get because we designed first a 1 week training program. but they are not ready to attend a 1 week training program, even if at their own village or in the cluster of the villages also. So it is very difficult. Of course, it's not easy to train uh, these people. And it is, of course, you have to do a lot of persuasion, you have to motivate them, and you have to tell them that after training, you get a certification so that nobody will question you. So that type of validation you will get. So such motivational factors, even if we give only 40 to 50% of the traditional healers only will attend your training program. All will not attend your training program. And it is a long process. And once they get the importance of the training program after attending, if they feel that there is a knowledge that they gained and it will be useful, and only they will spread the positive vibes to the others. So it is a long way to go in terms of training of these traditional healers.
Okay. Are there any other questions? Please, you can put on your video and you can directly ask the questions. Another question is, what is the status of suicide in tribal women? Any specific uh, reply to
Uh,
this?
No,
Suicides.
we have not come across any suicides in that, but there is of course, some maternal deaths are there still, uh, maybe because of various reasons, especially the blind faiths and beliefs which they follow,
Yeah.
and they reduce their diet when they become pregnant,
Oh,
or dietary pattern. They change the dietary pattern because if they eat more, they think that they will have a heavy baby, and they don't want a heavy baby because they have to go to the institute for delivery. They always prefer a, a home delivery by the traditional birth attendant, or nowadays, of course, in the area where we are working, the local sub-center nurse is going to the home and delivering the baby. So they prefer a home delivery, whether it is by a trained person or a skilled person, or because now trained means we have trained all the traditional birth attendants already in the area. So they are now trained birth attendants. But now they are accepting to get a delivery done by the trained nurse
at
and
home.
at home, because immediately after the birth they do some rituals and they don't bring the baby out of the home, and the delivery is conducted in a dark room.
So still all those old practices are going on.
Yes, are still prevalent, at least 25 to 25%. Even today, 25% of the deliveries are conducted at home, but by a trained or a skilled person. That means a nurse is conducting at home, but because they want to conduct in a way which they prefer the delivery, because they have a very deep rooted beliefs of a child bearing and a delivery process, everything. They don't want to expose the newborn baby immediately to a illuminated light. They want that it should be in a dark, so that slowly the light can be shown to him. And also they don't want to take the baby out. Even the mother also will not go out outside the
Okay.
home for a month, because like you said, witchcraft. That is, they think that evil spirits, evil spirits will be around, and they don't
Okay.
want to go. They
Yeah.
don't want to go and take the baby outside. So even the postnatal care is also has to be given at the home. That's why
Okay.
the motorbike ambulances that we are using, the trained nurse go to home for a postnatal care, to provide the postnatal care, because the woman or the child will not come out at least for a month.
Okay. We have another issue, a question by Dr. Shannon on mental health. She's asking that are there any mental health experts or counselors or the therapist at primary care level in this area?
Uh, Actually, now national mental health program is there. You see, all the government medical officers are trained, because now the mental health is part of the primary health care as per the national mental health program. So these government medical officers, I am talking about because in this area, in this tribal block where we are working, there are 10 government primary health centers. In these 10 primary health centers, the medical officers are trained in the mental health issues and how to deal them at a primary health center. But how much is being implemented, we don't know. But
Oh,
our two medical officers, we have two centers where we have trained them. Medical officers, we have trained them in the primary health care how to deal with the mental health issues.
okay.
And they
So
are
this is
all
the question.
referred to our psychiatry department here.
So this question was from our senior member, Ms. Kamiani.
Yeah.
She's from Mumbai. She is lawyer by profession and social activist. So thank you, Kamiani, for asking this important question. Uh, any other questions so that we
We
can
have we have Surekha Game who has raised the hand. I have permitted her to speak. So Surekha, you want to talk?
please
Ask any
put on
question.
your video and yeah,
You can unmute
please
and
go
you
ahead.
can talk.
Please unmute.
Who are you talking to, Sarika?
She's one, I think, nursing staff of
She's a
our hospital.
participant. I have asked her to unmute.
I
We have given
don't.
her permission to talk.
Okay. We need to start wrapping up, though.
Yes, yes.
Yeah, okay. So I'd just like to comment that it was a wonderful program, Dr. Soma. And, it is great listening to you, and your vast experience and the work which you have done is evident by not only your presentation, but the way you have interacted and, really, I just, a few days back, I read in the news that our chief minister is also holding talks with AIMS and other
Yes.
medical colleges to draft a tribal policy. I think it is very
Yes.
apt
Yes.
that
Yes.
which such kind of health parameters in the tribal people, we do need a health policy, especially for
Actually,
the tribal
yeah,
people.
I agree with you, because Dr. Abhay Bang's report has categorically said that all the medical colleges in India should adopt tribal areas in and around them, so that they can provide the much needed not only the primary healthcare, at the tertiary level healthcare is also. So now a national level tribal health policy, if that comes, that would be really helpful.
So I think we come to the conclusion of this particular very important webinar on tribal health. I thank all the participants, panelists, and our guest speaker, Professor Som Sundaram, for sparing his time for today's activity. And this topic was really close to our heart. And we thought that yes, some discussion should take place on this health of the women who are marginalized and who need our attention too. So thank you very much.
I would just like to add one thing, which Dr. Bengal, which is I want to commend you so much on the results. It's not just what you're doing, it's the outcomes. So the slide in which you showed the reduction in maternal mortality and infant mortality and in early age at marriage is very impressive to have achieved over this period of time. So thank you so much for sharing this important work and the work that both of you do in these communities. And I'd also like to thank our program committee for bringing this very interesting and exciting program to Women in Health Together for the Future. Please join us if you're not already a member. And thank you all for coming.
Yeah,
I would also like to thank our moderator here, Dr. Bangal, who has taken all the efforts. And yes, lots of participants have also joined. And we have posted a link for a feedback. I think more participants can view that link. If you click on the link, you'll go to the feedback form. Once you fill the feedback form, you will be receiving a certificate on your email. So please take this opportunity to click on the link for the feedback form and you will be receiving the certificate. Please join our organization at the website. Please visit our website w24f.org. Dr. Somasundaram will be sending you a link personally and with a personal note of thanks to you. Thank you very much for gracing the occasion and providing such a beautiful insight into the health of tribal women. Thank you so very much.
Thank you very much. Thank you for inviting me on this important topic. And credit goes to Dr. Bangal. Actually, although we are working, but in bringing down the maternal mortality, infant mortality, everything is the clinicians who are doing excellent job in delivering all emergency cases coming from the Bandardara area and with a very high success rate.
So thank you very much, everyone, and good night.
Thank you.